Hi, my name's Barry Kenneally. I'm a sports medicine doc here in Philadelphia, and I work as a consultant for Musculo as well. So treat athletes with sports injuries, but also treat a lot of people with osteoarthritis, rheumatoid arthritis. So have a lot of experience with working with people with sore joints.
Excellent. Dr. Kenneally, how did you get into sports medicine and just kind of that role? What drew you to that side of medicine?
But I started as a family doc, and when I was in training at our residency program, we took care of college students at Bryn Mawr College and Haverford College. And then when I graduated, then continued doing that at the colleges, and then one thing led to another, and I started doing that full time, and then got tasks with taking care of the athletes over at Penn for about 10 years. So kind of it took a long time to get there, but got there.
That's excellent. We're going to talk a little bit about joint and inflammation supplements and kind of what we need to know about them. So we're really excited to have you on to walk us through this process. Where do we start? What do we look for, or what sort of resources might be available to us as people to gather information on supplements?
Yeah, you're right. It really can be overwhelming. There's so much out there, and almost too much information about it all. But the way I approach it is generally, problem focused. Like I'm not a big person to recommend like a multitude of supplements, and the ones I'm usually recommending for my patients are things that can help with joint pain, joint inflammation, things like that. So trying to focus on very specific things, and there are a number of things out there that are great for the joints. The good resources, like you said, there's a lot of information out there, but there are some good resources online. Drweil.com, it's drweil.com. He's an alternative medicine doc out in Tucson, I think now. But he had a big book that kind of helped start the integrative medicine, alternative medicine movement in America about 20 years ago, probably 30 years ago now. But that's a good source. Consumer Reports actually has a health newsletter that's very good also. And also like Harvard's Medical Letter, which is a kind of a weekly newsletter they put out that's directed for the patients, and can break down all this information on supplements and medicine and alternative medicine.
So, with all of the supplements out there and available to regular people, and if we talk about joint and inflammation supplements, and a lot of them being really expensive, can you help us understand or tell us what supplements are really excellent for joint health and joint inflammation?
For joint health, for someone with osteoarthritis and just which is cartilage wear in any joint, and that commonly happens with age or with injuries or with inflammatory disorders over time, that can take a toll on the cartilage. So three things in particular can really help with that. The glucosamine is one, chondroitin is another, and those two usually come in the same pill. Just take them every day like a vitamin. And increase in evidence over the last few years too about collagen supplements, how they can help to preserve the cartilage in the joint and also help with pain and inflammation.
When we start taking those supplements, can you give us an idea on how long it will take for us to feel something or notice the difference?
Typically takes about 4 to 6 weeks, and it's a very gradual thing. And I take those myself, and it's the kind of thing where you don't notice it a lot when you start taking it, but I notice when I run out, and I'll run out and just like not have taken it for a couple of weeks and notice some soreness, like, oh right, I ran out of those. And just kind of starting back up. But it takes about 4 to 6 weeks to really feel the effect.
Excellent. And are there any prescription supplements for joints or arthritis that you can talk about today?
Not really. I mean, there is an injectable supplement, hyaluronic acid, or HA for short. It's available as a pill, as an over-the-counter supplement. It doesn't work great like that. It tends to work better when you inject it into the actual joint, which is mainly for the knee. You can use it in some other joints, but insurance only covers it for the knee. But that's kind of the only real prescription one that's out there for the joints.
And now we've spent all this money on these great supplements that you recommended. Tell us about the best way to take them so our body absorbs them the best?
Best to take them with some food. That helps a lot with the absorption. Some people with the glucosamine can get a little bit of an upset stomach. So if that's the case, the liquid form tends to be better tolerated.
Excellent. So, are most supplements, as you mentioned, better to be taken with food than on an empty stomach?
For the most part, yeah. Yeah, and
Okay,
vitamins too, we get better absorption.
excellent. That's really good to know. And when we're talking about supplements, as I said, I took a stroll down the aisle and I was looking at vitamin D, for example,
Mm.
and there's probably 20 brands or more of vitamin D. And one of our members asked, do the brands really matter?
I think for the most part, they don't. There's certain forms that are better absorbed, like the Phyactive is one that's kind of like comes in a caramel, that yeah, calcium supplement, and that's so there are different versions of it, but the brands, it's tricky. It's not really well
Hmm.
regulated, the supplement industry, so it's best to go with like a brand that you're familiar with or that's been recommended.
Yeah, and does cost play a role? Like, is a $10 bottle of glucosamine better than a $40 bottle or vice versa?
Not necessarily, a lot of the cost is just, artificial or, profit or sometimes advertising.
Okay, that's also good to know. That means that, that $40 bottle doesn't necessarily mean it's going to give you anything more than the $10 bottle.
Yeah, and I like if the drugstore itself has their generic version of a drug or a supplement, that's a, reliable big organization that you can usually trust.
That's good to know. And as you and as I know, and probably most of our members too, realize that supplements are not regulated. And are there any sort of red flags that we should be looking for when we are purchasing supplements?
The no, I mean, if it seems too good to be true, I mean, there are all kinds of things out there about memory and things like that, and we can't even find prescription drugs that'll help with memory, and so if it seems too good to be true, it probably is.
Okay, so false claims or false advertisements
Yeah.
around those sorts of things is kind of what I'm hearing. What type of natural supplements? So when I think of natural, I guess I'm thinking more along the lines of food. We talk a little bit about inflammation and curcumin and turmeric. Are there any food items that provide um, a natural supplementation for joint health or joint inflammation?
Yeah, and the ones you mentioned, I think, are great, and also ginger can be helpful. The And we have a lot of nutritionists out there that'll work on an anti-inflammatory diet as well, which talks. It's a lot about carbohydrates and processed foods, but definitely that's something that can help. And those things are available as supplements too. The ginger, the turmeric. If you are going to get the turmeric, it's good to have the mixture with curcumin and also black pepper extract, which helps you absorb it. But those things are all helpful for joint and inflammation in general. And a lot of people, rather than go out and buy these expensive supplements, another thing is to just cook with it. Same with fish oil. Rather than taking a supplement, you can actually just add that to your diet. They're very much into that in India. They look at food as really a medicine, and that's part of why I think you see so many spices in Indian food.
Yeah, they definitely practice something more along the lines of Ayurvedic medicine there, which
Yeah.
food tends to be a really big part of that. And as being a consultant for Musculo and working with us, we talk about lifestyle pillars, nutrition, movement, sleep. And I'm wondering what your thoughts are on how supplementation can support those other sort of lifestyle pillars.
Yeah, I mean, well, a lot of people like the melatonin for sleep. Yeah, it's even a prescription over in Europe, which it's kind of good and bad, I guess. It can be, you know, we have to pay for it out of pocket over here, but at least over there it's a little more regulated. So, take the good with the bad. But that's something that can help. And I don't know that any of these supplements would help specifically with like exercise, but they could reduce inflammation so that the exercise is more enjoyable or more easier to do it.
Yeah, that's really good to know. We have a couple questions in the chat, and I want to get to them before we move on, just so we're still kind of fresh in the memory. You had said something about the joint injection,
Mhm.
and one of our members wanted to know how often can you get the joint injection?
The insurance will cover it every 6 months typically. When it first came out, some people would do it every 3 months, but now it's pretty much every six. But if you can pay out of pocket and get it more frequently.
Excellent. And what is the dosage for collagen?
The That's tricky. I've been trying to find a standard version of that. And I just recommend following the directions on the label because there are all kinds of different mixtures. You have the types 1 and 2 collagen are better for the joints, and the types 3 and 4 and 4 and 5, I guess, are better for skin and hair. So, and they usually have a mixture of them all. So I would just go by the recommendation on the bottle.
Yeah, and collagen comes in pill form as well as powder form that you would mix into a liquid or a smoothie. Is one more superior than the other?
Shouldn't make a difference if you're as long as you're taking the pill with a meal. That kind of should suffice. If you feel like a smoothie or something instead the powder should work fine.
Great. So, 1 and 3 are great for joint health, and then
1 and 2, and then
one and 2
4 and 5 for skin and hair.
for skin and hair. That's great. One another member asked for supplements and verification. Are there third-party verification for supplements? And if there are, what are they and how should we look for those?
The best one I found is really Consumer Reports. They tend to vet items pretty well, so I trust them.
Okay, great. So consumer reports for those
And it's a specific was it the health letter, I think it's called, or no, Consumer Reports on Health is
consumer reports
their
on health.
medical newsletter.
Okay, excellent. I'll put that in the email that we'll send out after we're done chit-chatting here. And another member asked about taking turmeric or curcumin supplements and the concern around lead content. Is it an issue?
It can be an issue with any of these things, and that's why I think it's good to find a legitimate company that a brand that you trust, and also like not to overdo the amounts. It's really just if you're going beyond the recommended dosage, I think that's when you can get into trouble.
Okay, that's always good to know. With supplements and medication, and let's just talk maybe about the supplements that you mentioned. Are there any big interactions that we should be concerned about when taking them?
They shouldn't interact with any medicines, especially the herbal ones. They're just something that you can really find in your food. But the glucosamine tends to be the less tolerant of the other types, the collagen, chondroitin, and glucosamine. But the glucosamine sometimes can upset your stomach, and very rarely diabetics can notice that it can interfere with their sugar regulation. So they're really the two big things, but it shouldn't interact with any medicines.
Okay, that's really good to know because we know that there's a lot of interactions between medicines. So it's nice to hear that the reactions are non-existent or far and few between.
Yeah, because these really are just kind of natural products. I mean, all three of those things are just kind of building blocks for our joints. So it's kind of something that's in us already. So
Absolutely.
natural.
So when we're talking a little bit about inflammation and we're talking a little bit about joint health, in addition to supplements, because you are sports medicine, what are other things that we should be thinking about or doing to keep our joints healthy and our inflammation low?
I think low impact exercise is important, especially when you have joint inflammation. You don't want to be like pounding on those joints. So I think gentle movement, I mean, Tai Chi is a great example, can get you a pretty good workout too, and brisk walking. So when you do like the high impact exercises like running, that's when you can get more inflammation. So gentle movement, and I think stretching is important, especially as we get older. That's something that the tightness is something that it's going to just get worse over time. And I think as we get older, doing things like yoga or Tai Chi can really help to keep your mobility and range of motion.
Yeah, so it does really sound like it is those lifestyle pillars. We're doing a little bit of everything to
Yeah,
stay healthy and well.
yeah, it really is, I think.
Are there any risks to taking supplements? Are there any downsides to adding these supplements to joint health or joint inflammation?
No, I've seen very few people have like bad reactions. Sometimes people just don't tolerate them, especially the upset stomach with the glucosamine at times. But they're all pretty much natural products. So as long as you're using recommended doses, there's not much downside. It doesn't work for everyone. That's probably the biggest downside for people. I tell them that these don't work for everybody, but they help me, and I've seen them help a lot of other people.
And in your opinion, why does that happen? Why do some supplements help one person but not others?
Yeah, I wish I knew, but yeah, it's hard to know. I mean, even that injectable, the HA, about 20% of people it does zero, and some people it does wonders, and then everyone else is kind of in between. And we've been trying to figure out ways to figure it out. Sometimes it's the amount of arthritis they have that there's just more cartilage loss, and that's part of the issue. But it's a very hard thing to measure and predict.
Do we have any questions from our members out there?
Eventually, do I, since I'm feeling better, will I be diminishing the dose of these supplements, or does the dose stay the same in your experience?
I think it's always a good idea to try to wean off them or lower the dose. There's no harm in doing that from time to time, maybe every you know 6 months or so. Just see if you can get by with less, because like I said, they are expensive.
Yeah,
Mhm.
that's a really great question. The ability to lower the dose or take yourself off from time to time if you're feeling pretty great
Yeah.
is what I'm kind of hearing. Maureen wants to know, should joint supplementation be taken as a preventative strategy?
Probably not. I mean, if you're getting some osteoarthritis or inflammation, I would use them, but yeah, I wouldn't recommend them across the board for everybody.
Yeah, and I know that we just see a lot of commercials and infomercials around that everybody should be taking these supplementation um, products. But it sounds like, Dr. Kenneally, you're really suggesting that if you don't have the issue, you shouldn't be taking the supplements.
Yeah, that's the way I approach it. Or else, I mean, like you said, you'd be taking everything in that big aisle. You wouldn't need food after all eating all those supplements. But yeah, I think it's best to eat a balanced diet and get a small amount of those supplements that way. And then if anything does cause you some issues, then you can just target it that way.